Welcome to Infectious Laughter Podcast.
Where real, ridiculous, and relatable moments from working in healthcare are shared.
We respect HIPAA because it's real, and we like our licenses. Now let's do this with culture and sensitivity. How about now?
I can hear you.
How do I sound?
No delay.
I sound gorgeous?
Yes. Does it look like I'm recording?
You are recording.
Okay, well, I guess that's all we need.
Okay. So, like episode 2. Take
3.
I don't even know how many. Take 3. Okay. Well, welcome, Nancy. We're back.
Yes.
Yes. And today we are talking about
Animal bites. I don't see a lot of that where I work.
Okay.
We have had people come into the ER
Sure.
recently with squirrel attack. I don't know what that entailed, but they did not come. They were not admitted to the floor.
Okay. Well, I think it would entail a squirrel biting somebody.
Probably. A lot of people thought, well, she came to see if she has rabies, but you wouldn't know immediately unless you brought the squirrel with you.
Oh, God, please don't bring animals to the ER with you.
No.
Yeah. No. But that's true. So there's no way to know if you've been exposed to rabies until you've already gotten rabies.
And you don't want to get rabies, so you need to prevent rabies. If you don't know for sure that the animal had rabies, you have to do the preventative measures.
Right, which entails a vaccine or AKA a rabies shots.
Right.
Right.
Which, when I was growing up, everybody talked about how horrible that is, and it's a series of shots in the stomach, and it's very painful. Apparently, that's not true anymore.
Correct. So it's 4 shots given. I have it written down, Nancy, so I can remember. These shots are given.
They're like maybe a week apart, several days apart, an hour apart, like labor.
Oh, here we go.
Contractions.
Yeah. Oh, you didn't have any children, did you?
No.
No. So
you can tell.
They're given in the arm, the deltoid, on day 0, so the day you come in, day 3, 7, and 14.
Well, that seems much less horrible than what I grew up hearing about.
Yeah, I grew up hearing there were all these shots in your abdomen, and they were super painful and horrible. Right.
I think that did used to be the case. There was some sort of...
Yeah, I don't know. I mean, that's thankfully not the case now.
Right.
And I will say that as I think about what I used to think and what I think now, I'm glad it's what I think now.
Yes.
But also, I wanted to say, if you have gotten that 4-shot series and you get another possible rabies bite, you only have to get 2 shots after that.
Oh.
So.
Well, if you're getting another bite, something is wrong. I mean, what are you doing that animals keep biting you?
I wonder how many shots that crocodile hunter guy got.
Oh, I don't know.
Yeah.
Do crocodiles get rabies?
No, because they're not mammals.
This is true.
Yeah. But like he did other animals, didn't he?
Yes.
What about that guy? The tiger guy?
Oh, the Tiger King?
Yeah.
Did he
get
bitten?
Like that group.
I'm like the only person in America during the pandemic that didn't watch that, but that's because I was working.
I mean, I was working too, but I eventually just had to go, what are they talking about? And I got sucked right in, Nancy. Sucked right in. Anyway, so good points would be how high risk a shot is.
Mm-hmm.
Right? Or a shot.
Oh, a bite.
A bite.
Yeah.
Thank you.
Yeah.
And so we'll get into that when we get into education time. But I do have some stories to share.
Oh, goody.
Yeah. So I'll start with, I was told by a coworker who worked in a different state that he was on the day when a woman came into the ER with a raccoon attack. She was extremely high on a substance, I don't recall what it was, and she thought the raccoon was her boyfriend. So she picked up the raccoon from the backyard and tried to kiss her boyfriend, the raccoon, and the raccoon was not down for that.
Does her boyfriend have 2 black eyes or?
Or he's really hairy? And I mean, larger than a cat, but smaller than a dog? I don't know. But those things have some serious claws and some serious teeth.
Their hands are almost human-like.
Right.
Because they can grab at stuff. But I suppose if you're high on a substance, none of that would mean anything to you.
Right.
Did she try to kiss it on the mouth?
I would imagine. I mean, I don't know how much she's kissing her boyfriend's hairy back or whatever.
So did she have to have the rabies shots?
Yeah.
Because she didn't know if the raccoon was rabid.
Right. And raccoons are high risk, which we'll get into more. But
right.
Yeah. So my personal story was from a gentleman who went to visit family in a Middle Eastern country. And they had a pet male lion.
A pet?
Right. Apparently it was some status symbol, or it's not uncommon in this country where he was to have a wild cat, either a tiger or a lion as a pet. So apparently this lion never liked my patient.
Oh.
And he showed me video of the lion on the roof of the complex where his family lived. He was chained. He looked thin. He looked kind of hungry. More Lion King middle of the movie.
Right.
And he went to pet the lion, and the lion kind of reared up and he backed up real fast.
Mm-hmm.
But unfortunately for my patient, he was walking from one room into the kitchen, and the lion was chained up in the kitchen. And
inside the house?
In the house.
Okay.
So, right. I guess they walk him upstairs for fresh air. I don't know how all that worked. I didn't ask all those questions. Maybe I should have. But I was trying to take care of the patient. Right. So I couldn't be like, so tell me about what's going on. So he was walking into the kitchen, and the lion jumped on top of him, knocked him to the ground, and bit him in the thigh.
Oh.
And his cousin, thankfully, was there, who had trained the lion. And he had trained the lion that when he would put his hand near the lion's mouth, the lion would open his mouth. And so he was able to get the lion to release the cousin, my patient.
Okay.
And he was pulled away from the lion.
Lions have long teeth, so these would be deep puncture wounds.
Right. And I don't imagine they ever brushed the lion's teeth.
Probably not.
Yeah.
I would say the first takeaway is you don't want a hungry lion as a pet.
I would say I don't think I want a lion as a pet, but if that's your first takeaway, Nancy, yes. So at any rate, yeah. He was taken to the hospital in said country, where he was given one shot of an antibiotic and sent on his way. And then he flew home, which took about a day. And by the time he made it to the United States and to our hospital, he had a massive abscess in his thigh that had to be surgically drained. So an abscess is a pocket of pus under the skin.
Right.
And he was very uncomfortable.
And probably septic.
I can't remember if he was septic or not, because believe it or not, this was during COVID times, But he was on a floor of the hospital that is not typically used. It was sort of an overflow. Every time I go over there, I think of my guy.
Yeah.
I went down a rabbit hole researching this a little bit for this podcast. And if I pick a random country, I picked Pakistan.
Okay.
According to ChatGPT,
Mm-hmm.
in 2019, there was an estimate in Karachi, which is a big city in Pakistan, that up to 300 lions lived within Karachi city limits and were kept in gardens, rooftop cages, or farmhouses.
Wow.
Yeah.
Are lions a natural animal in Pakistan, or are they imported?
All right, I didn't research
That you didn't research.
But they are bred in Pakistan, I think, to be pets to the wealthy. So then I wanted to know, well, in the U.S., how many lions?
I don't think that's legal. Maybe to keep them outside, but not inside.
Okay.
I have.
It is not
legal.
legal.
This rabbit hole.
It is not legal. So apparently, according to our friend, the AI.
Mm-hmm.
God, I sound really old calling it the AI. Sorry.
Like the Google.
Yeah, the Google, the AI, the Facebook. Anyway.
Interweb.
Yeah. There are a few thousand privately kept lions through exotic pet collections, small private zoos, and private sanctuaries in the U.S. So then I wanted to know, obviously that sounds like a lot.
It does.
So, but given what's the population of the United States compared to, say, the population in Pakistan? Because then I looked up.
So the U.S. I know is like 319 billion.
Close. So the estimated population was 343 million.
Okay.
And the estimated population of Pakistan was 255 million.
Oh.
Which is a lot because it's not a huge country.
Right.
But I also looked up another city or province, the Punjab province, and it said approximately 584 lions and tigers are housed in homes and breeding farms. And there's an estimate of 800 to 1,200 lions in Pakistan.
I did not know that.
That's a lot.
Are there a lot of animal bites?
There has to be. But essentially through the power of math.
Mm-hmm.
In Pakistan, there is one lion to every 318,700 people. And the United States, one lion to every 1,333 people.
So there's per capita more lions in the U.S.
Right.
Huh.
But I didn't do population density numbers.
Right.
I didn't go that far down the hole. But if the United States is like this, Pakistan is like,
right.
Wait, video. U.S., Pakistan, size-wise.
Right.
So I would imagine
it's
for density.
Lion dense.
Right. There are no private sanctuaries in Pakistan or private zoos.
Right.
You know.
You know, the actress Tippi Hedren had a sanctuary. I think she's still around. That's Melanie Griffith's mother.
Okay, thank you for telling me who that was because I had no idea.
And she had lions.
My mind just went to the movie The Hangover.
Oh, right.
Where I think that was a tiger.
Mm-hmm.
And it was the boxer. Mike Tyson had it.
That's right.
I don't know if that's factual that Tyson has large cats as pets.
I don't know.
But anyway. So that's where my brain went.
Right.
And definitely lions would be high risk for rabies.
Really?
Well, unless they're vaccinated.
Right.
Which I don't think it's really legal for sure in the U.S. I don't know. I didn't go down to find out in Pakistan.
All right.
You know, because I just picked this country.
So did this patient have to undergo the rabies protocol?
Yeah. Because he didn't know.
Right.
I mean, I guess he could have called his family to find out if the lion was vaccinated.
Right. The thing is, so most people who get bitten by wild animals don't see the animal. I mean, they don't keep the animal. The animal bites them and runs away.
Right.
So you have to go through the protocol. you can't wait to see if you start getting symptoms for rabies, because if you do, there is no treatment.
Correct.
So they at least still had the animal and could have it tested, but he was so far away, and who knows what the testing is like in Pakistan or wherever.
Right. And I don't even know. To me, I would kind of want to err on the side of caution. I mean, even if well, I don't have any cousins. I don't know if you know that. I have no first cousins.
Okay.
So, but I have friends who have cousins. And, they're usually described as like kind of that crazy cousin. And so would you believe your crazy cousin that your
Right.
exotic lion was vaccinated? It's up to you. Right?
I'd probably just undergo the shots.
Right. Well, you and I. Yeah. I mean, teach their own. But so that led me to if you were bitten in the United States with a high risk animal, how do you get the consent for the rabies shot? There's a lot of drama with vaccines these days.
Right.
The rabies shot is considered post-exposure prophylaxis.
Okay.
So after the bite, we're preventing rabies from happening.
Right.
Because there's no way for us to like test your wound or your blood to see if you were exposed. It takes a long time. And in fact, you're already showing symptoms by the time you can isolate that.
Right. And if you're showing symptoms, bye-bye.
Right. I mean, unfortunately, it's a very painful death as well.
Is rabies a virus or a bacteria? Virus.
Oh, man.
Oh, stumped you.
How do I not know that?
I'm thinking virus. Are we going to the Google?
Well, I do have an app actually that pulls from literature, medical literature. So I will use that sometimes, because the Google pulls from anything.
Right.
So you can't believe that.
Right.
The
AI that is at the top of your Google search is drawn from all sorts of information and has been wrong.
Oh, for sure. Well, that's why I don't like when someone Dr. Googles me.
Right.
And says, well, Google says my whatever means this. I've had one patient say AI told them. And I said, did you just Dr. AI me? So you win, Nancy. Rabies is a virus, not a bacteria. Yeah, there you go. Oh, my gosh. I hope my coworkers don't watch this episode and didn't know that. I didn't know that. It is specifically a viral zoonosis, which makes sense because that means animal-based.
Right.
Right? So when I've actually shared this story, I've guest spoken at high school that has like a medical program. And my patient actually airdropped me the video of his bite.
Oh.
It was on their Ring camera. And he informed me that I was not to post it on Facebook specifically. So I have one child who's way more technologically advanced than I am. And he was able to blur faces from the video. And so the first time I guest spoke at the school, I shared this video. And the next year I came back and a girl came up to me and she says, are you the lady with the tiger bite? And I go, no, I'm the lady with the lion bite. And I have yet to share it on social media. So,
right.
But I do have it if you want to see it later.
I would love to. This patient fared well?
Yes. I mean, he got the right antibiotics. First of all, one dose of an antibiotic is not enough, right? And surgical
And it would
cleaning.
have to be a very broad spectrum antibiotic because you don't know. The cause of the infection was not rabies. It was something else.
Oh, for sure. Yeah. Because an abscess is bacterial based. Right. So the bite got infected.
Right.
And that led to
Abscess
abscess.
is actually a collection of pus, which, is the body's, it's a collection of white blood cells that the body sends to a site of infection.
Exactly. Right. And often we'll need surgical drainage if it's large enough, and his was.
Well, and because the teeth are so long, that would be very deep. And so, unless immediately upon being bitten, he was able to cleanse the wound very deeply, which would be hard to do.
Right.
Yeah.
Right. And I don't know what the medical care was in the country he was in. I can't speak for that. But typically, now I don't work in the ER, so I had to look up, what's the protocol
for a lion bite?
for an animal bite.
Yeah.
So keep in mind that rabies is only with mammals.
Yes.
But if you have any kind of time you come to the emergency room, they're going to take your history.
Yes.
We need to know who you are, what medical conditions you have.
Have you traveled recently?
That kind of thing. And what bit you. Mm-hmm. So we do see a lot of spider bites. Mm-hmm. Sometimes people bring the spider with them. And
wow. Yeah. Most spiders don't bite and hang around.
Yeah. I don't know. You kill the spider and you bring it with you, and usually a Tupperware. I don't want to see that.
Yeah.
Yeah.
Tupperware is good for so many things.
Right. So I don't want to see the squirrel from your example.
Right.
Right? Because that's going to be intense.
Yeah.
Yeah. So anyway, we get a history to see, what are you at risk for? Right? How deep was it? What is this? What did you do after you were bitten?
Right.
Right? Did you put a towel around it and rush right to us? Did you clean it? What did you do?
And if it's red and inflamed, we will often with a marker, draw a line around the redness to make sure it's not spreading quickly, because that's a whole different thing.
Right. You mentioned deeply cleaning the wound. So wound management is huge.
Yes.
Getting it cleaned out. And then usually, if it's a cat bite, I'm going to scratch that. If it's a cat bite, prophylactic antibiotics should be given.
Cat scratch?
Well, there's a difference between a scratch and a bite from a cat. I actually had a patient once that a lot of the documentation or what was communicated to us was it was a cat scratch, and the patient was on appropriate treatment for that. But then when I went to speak to the patient, I said, so tell me what happened. She says, well, I feed these stray cats all the time, and they're the same ones. And when I put the food bowl down, the one cat bit her on the hand.
Oh.
So I had to very quickly change the antibiotics.
Uh-huh.
But yeah, so there should be an antibiotic given.
Which is why taking a history and asking these questions is important.
Right. And sometimes confirming them. Mm-hmm. Sometimes patients will tell me one thing and then they'll tell my physician colleague something different.
Yeah.
And I don't know why that is.
And sometimes they'll tell you one thing in front of their family and something different when no one else is around.
Yeah. And sometimes they'll tell the bedside nurse they've gotten to know and they feel more comfortable.
Mm-hmm.
But it's a challenge because there's a difference.
Right.
So anyway, now post-exposure prophylaxis. Post-exposure prophylaxis. Yeah. For rabies, high-risk bites we talked about.
Mm-hmm.
And those are considered raccoons, foxes, coyotes, bats, and skunks. For sure, high risk.
Yeah.
And those bites are reported to public health agencies. And then it's important to follow up to make sure wounds are healing and the rest of the vaccines are given. Because you're not going to stay in the hospital for 14 days.
Right. So squirrels are low risk.
Squirrels, amazingly, yes. Before this episode, I Dr. Googled it and checked it with my other source. And apparently, as of today, there had not been a report of rabies from a squirrel bite. So I would still go to the hospital and have it checked.
Yes.
And cleaned.
Because you can still get an infection.
Right. And you want it cleaned, from
right.
people who know how to clean wounds.
Right.
I thought that was fascinating because I would thought like squirrels have kind of big teeth.
They do. But now squirrels are not carnivores.
Mm.
They eat nuts and such. And I think that might be a difference.
I don't know.
We'll have to Dr. Google that.
But what about bats eat small insects?
It depends on the type of bat. But yes,
Yeah.
bats, which are the most common.
And what do skunks eat?
Oh, I don't know.
The only thing I know about skunks
I
is
want.
yeah. And stay back.
Yeah.
The only thing I know about skunks is from Looney Tunes.
Pepe Le Pew.
Pepe Le Pew. Oh. Mwah, mwah, mwah. So, I mean, I'm not an animal handler, right? Like,
Right.
yeah. Yeah. Well, maybe, a zoologist or something will contact us. Who knows? But early treatment and history definitely important, right?
Yes.
What symptoms do you recall about rabies?
Well, everybody talks about the foaming at the mouth. And I know that has something to do with, isn't there like a hydrophobia, fear of water?
Mm-hmm.
So they become very dehydrated, a little loony, they kind of go crazy.
Yeah, so it infects the central nervous system. So I looked that up too because
I have never had a rabies patient.
a rabid patient.
That, I guess they do become rabid.
Yeah.
So if the patient bites someone,
Oh.
it just,
Yeah.
cycle goes on.
So if you're rabid,
Mm-hmm.
I mean, where do you go? Like, I mean,
I don't know.
I don't know either. Huh.
So
sorry.
Yeah.
I was just like picturing that. Yeah. So, 80% of people with rabies get an anxiety, agitation kind of case, and 20% get a flaccid paralysis.
So they can't move, but they're not rigid. Like the muscles are not contracted like in tetanus.
Right.
Okay.
Right. So I just thought 100% of people would get the same thing.
Yeah, I did too.
So I thought that was very interesting. And the medical term would be clinical manifestation, but basically you start showing symptoms after 20 to 60 days from incubation or from the bite. And that progresses to neurologic dysfunction, coma, and death. And survival after symptom onset is exceedingly rare.
Like almost zero.
Yeah.
Yeah.
The 80% of people, one of the first things that people will notice is hydrophobia, like you said. They actually are so afraid of water that the sight or hearing water can cause them to go into a spasm.
Oh, wow.
And then they also can develop aerophobia, which is fear of air drafts.
Oh.
Yeah. Which would be horrible in Florida because
Yeah.
we need air conditioning, And then they get hypersalivation.
That's the foaming at the mouth.
Right. And then episodes of excitement as well as hallucinations that can lead to delirium or complete confusion, convulsions, and then coma.
So if a person becomes symptomatic, since there's no treatment, they must manage it somehow so that the patient is comfortable. You wouldn't just leave a person at home to go through all this.
Oh, no. Can you imagine? Nobody wants all that suffering.
I suppose they would be given just pain medication and sedation.
Maybe. Yeah. I mean, something, because you want to make them as comfortable as possible.
Right.
That 80% that gets that, they die usually 7 to 10 days after symptom onset.
Wow.
So it's pretty fast.
Yeah.
And then the 20%, it just says usually the paralysis, that kind of weak. Like when I think of flaccid, I think of like a cooked spaghetti noodle kind of thing.
Right. No muscle tone.
Right. Usually starts in the bitten limb.
In the what?
In the bitten limb.
Oh.
So if you were bitten in the right arm, that's the first thing to, you can't control. It's just paralyzed. You can't move it. And then spreads throughout, leading to coma and death. But it's a longer course. It's.
See, I would have thought since it affects the central nervous system that the symptoms would emanate from the brain out. It's funny that the affected limb is the first thing to have symptoms.
And that's the smaller percent of cases get that.
Right.
So I think most of us are thinking of like that rabid kind of foaming and kind of crazy. And the animal isn't necessarily giving you those symptoms. You can't say, well, was the skunk like drooling and acting crazy?
Well, they may not have been symptomatic yet.
Right.
But they still carry the virus.
Right.
Yeah.
For sure. So, you can't just be like, well, it was just a normal skunk. Whatever. Yeah.
Yes. But I'm sure that there are areas and hospitals that deal with this on a regular basis. Yes.
I would think maybe more ERs.
Yeah.
Like for someone to be admitted to critical care where you are with an animal bite, they'd have to be completely septic from a
or have
secondary
been
infection.
Severely injured by the bite. Yeah.
Right. So I would imagine most of these encounters hopefully are handled with preventive antibiotics if needed, good wound care, and the post-exposure prophylaxis, and then sent home.
Mm-hmm.
I served time volunteering for the scouts. And there was one scout who on a camp out saw a raccoon getting into a garbage, the raccoon.
Okay.
So he wanted to pick him up.
Not a wise choice.
No. And he was very upset when I hollered and told the other kids to stay away. And most of them kind of ran into a shelter area because that raccoon was out at like 3 p.m., which is an unusual thing. Now, I don't know where a lot of scouts camp and maybe don't handle their garbage the way they're supposed to.
Right. And I know raccoons are often up in trees, but if they're hungry, they would come out during the day. But also if they had rabies and were becoming symptomatic, they would act a little crazy.
Right. And usually the raccoons come out at night. So
normally. But again, it might have been hungry. It was going into it.
Well, and maybe they were used to people, finding food and stuff. I don't know. But I still, again, I'm going to err on the side of caution. Yeah.
Absolutely.
Because I also thought about that patient of my coworkers and who picked up the raccoon. I mean, I wanted the kid to keep his face.
Definitely. Any educational or health-related discussions are meant for general information and entertainment only. They are not medical advice and are not intended as a substitute for professional medical advice, diagnosis, or treatment. Always consult your own healthcare provider for any medical concerns or decisions.
While we make every effort to ensure accuracy, we make no guarantees about the completeness, reliability, or accuracy of the information presented. Medicine is always evolving and content may become outdated.
The hosts and producers of this podcast explicitly disclaim any liability or loss incurred directly or indirectly as a result of the use or application of any of the content presented.
And most importantly, we laugh with our patients and coworkers, never at them.
बाबा तो मना टिक ही गए आप तो हम समझ लेंगे आप ठीक जाने
This episode had a few unique features for those who are listening on audio instead of watching on YouTube. I added a few notes that you can only see visually, so I figured I should probably inform you of what was provided. At some point you see, maybe around minute 16, that I blame perimenopause on not being able to come up with an answer. Later, you hear that I completely missed a pun for cat scratch, but Nancy definitely caught it. Then for follow-up research, you see that there have been no naturally occurring incidences, only lab-induced, of rabies in birds, a few logomorphs or cottontails, and rodents, such as squirrels, mice, foals, moles, or rats. You also learn that it is possible for squirrels to carry rabies, but they carry it much less often than other mammals, such as raccoons, bats, or skunks. And no, Nancy, the squirrel's diet does not have anything to do with whether or not they can have or spread rabies, but some attribute it rather to their small size and quick metabolism. Further information includes that raccoons are active from dawn to dusk, unless they are nursing mothers looking for food or if it is a warmer day in winter. Fun fact, according to the U.S. Postal Service, dog attack rankings by city in 2022. Number 1, Houston. Number 2, LA. And number 3, Dallas. Be careful out there, postal workers, as we do not want those dogs attacking you. As with everything in medicine, there's always more information to share. Inadvertently left out of this episode is the dose of human rabies immune globulin given near the wound after a potential rabies bite, as well as the opportunity that people who work with animals who may have rabies can take pre-exposure prophylaxis. Thank you so much, and we hope you continue to listen and cheer us on as we learn and grow.